The honey on your supermarket shelf that costs $50 to $100 per pound is making implicit promises that the $5 jar next to it is not. Manuka honey, produced from the nectar of the Manuka bush native to New Zealand, has built a $300 to $500 million global market on the strength of documented antimicrobial properties that genuine medical-grade Manuka honey does possess, and a consumer product market that has been extraordinarily effective at borrowing the credibility of hospital wound care research for products that may have nothing in common with what clinicians actually use. The active compound that makes Manuka honey medically distinctive is methylglyoxal, or MgO, which is present in significantly higher concentrations in Manuka honey than in conventional honey due to a precursor compound unique to the Manuka plant. MgO has well-documented antimicrobial activity against a range of pathogens, including some antibiotic-resistant organisms and medical-grade Manuka honey products, distinct from consumer grocery products, are licensed for clinical wound care in several countries, including New Zealand, Australia, and the United Kingdom. In hospital settings, these are applied topically to chronic wounds, burns, and infected surgical sites with documented effectiveness. The research behind this application is legitimate and peer-reviewed. The unique Manuka factor rating system, a number appearing on consumer product labels, was designed to standardize MgO content and help consumers identify genuine, potent Manuka honey. The problem is that research consistently shows therapeutic antimicrobial activity requires MgO concentrations of approximately 400 or higher. The majority of consumer Manuka honey products sold at premium prices in Western markets carry UMEF ratings of 5, 10, or 15. Ranges that nutritionists and medical researchers note are unlikely to produce the antimicrobial effects the products are implicitly marketed around. The gap between what the label implies and what the concentration actually delivers is substantial. The fraud dimension is perhaps the most serious concern in the Manuka honey market and the least discussed in the wellness media that promotes it. New Zealand's Manuka honey production is estimated at 1,700 to 2,000 metric tons annually. Global sales of products labeled Manuka honey are estimated at approximately 10,000 metric tons annually. The mathematics here are not ambiguous. The vast majority of what is being sold as Manuka honey cannot actually be what it claims. Sophisticated adulteration, diluting genuine Manuka with conventional honey, mislabeling product origins, or manipulating MgO measurements is an established problem that regulatory authorities in multiple countries have investigated without achieving comprehensive resolution. For the average consumer eating Manuka honey on toast or stirring it into tea, the primary effect compared to any other raw honey is a significant difference in price. Regular raw local honey contains hydrogen peroxide-based antimicrobial activity, prebiotic oligosaccharides, and pollen compounds with their own documented modest health properties, all at a fraction of the cost and with a supply chain that can actually be traced. The choice to pay a premium for Manuka honey as a culinary product, rather than a therapeutic one, rests almost entirely on marketing credibility that the evidence does not consistently support.